Tell us a little bit about polyps. Do people have polyps on the back of their throat? What might actually cause that, or hoarseness, I guess I should say?
Well, you can have polyps. Polyps are basically inflammatory tissue, and people have a chronic inflammatory condition such as allergies or an infection. The most common places we see polyps is actually in the nose and the sinuses. There's patients that will have a chronic sinus infection. They often will have trouble breathing through their nose, trouble with a sense of smell and taste. And these patients that fail medical management with antibiotics and anti-inflammatories often will get referred to us, and that's when we first make a diagnosis of nasal and sinus polyps. Most of these patients we can treat medically, which is good, but there is a subset of patients that continue to have problems that would need sinus surgery.
Now, you had mentioned snoring earlier. What are some trigger points for our viewers that they might need to seek medical attention for that snoring?
Snoring in itself is not a medical problem. I know my wife may disagree with that at times, but snoring is basically just a sound that the back of our throat, our soft palate, makes as it vibrates when we breathe at night. Snoring can occur up to almost 3 out of 4 patients that once they hit the age 65 and older, it's universal almost, most patients snore. The signs that we worry about where you're having snoring being a sign of something else going on, such as sleep disordered breathing or obstructive sleep apnea, would be the snoring is very loud, it's on a nightly basis. If you were to observe that patient, they may hold their breath, or they're very restless when they sleep, they don't seem that they get into a good night's sleep, and they're very tired during the day. Those are some things that we would be asking.
Tell us a little bit more about why individuals would seek attention with hoarseness or maybe their voice changing.
Hoarseness is something that we see on a daily basis. Hoarseness is kind of a generic term. We use the word dysphonia, which just means a difficulty with the voice. There's many things that cause hoarseness, and I like to separate patients based on whether or not they smoke. Smoking is a significant risk factor, as many of us know, for both upper and lower aerodigestive tract malignancies. So patients that have trouble with their voice for over a 2 to 3 week period, we would classify as chronic hoarseness. And if those patients use tobacco products, then we typically would suggest an ENT referral so we get a full, thorough evaluation in the back of their nose and throat. On the other hand, patients that are non-smokers are a little bit different. We're not obviously quite as concerned about a malignancy, but those patients have other problems that are causing the hoarseness. One of the most common reasons we see this are patients that have chronic reflux. Many of these patients don't have the classic heartburn of reflux, but many of these patients have other symptoms with their voice changing over time. They may have the sensation of something in the back of the throat where they clear their throat often or have a dry cough. They may also feel some tightness when they swallow. Those are very common causes of hoarseness in patients that are non-smokers.
Now, is that treated medically, or just depends on the patient, whether it be surgical or medical treatment?
Sure. Most patients that are non-smokers that have chronic reflux laryngitis, which is causing the hoarseness, get treated. They have to have more aggressive reflux management, but most of those patients get treated with medically, and it's usually something over a course of 3 to 6 months. This typically isn't a over the night, not like you have a sinus infection, get medication and you're better within a few days. This is something that may take a few weeks to a few months before patients get fully better.
And also to differentiate, we're not talking about the laryngitis that you might get from sinus infections or a cold, correct? This is something that is ongoing throughout the year.
Sure. This is something that patients often come and see me and they said, I've noticed my voice has been different over the last 6 months. I have these other symptoms. Whereas patients that get an acute laryngitis, which is again less than 2 to 3 weeks of a voice change, that's typically a trauma-induced, where you might be at a UK or U of L football game and screaming a lot.
Cheering, yes.
Or that you've got a viral infection that has caused a sore throat and changes with your voice.
So definitely something that's been ongoing for a period of time. Now, back to our ears a little bit. I've heard individuals say that they might have ringing in their ears. Can you tell us a little bit more about what causes ringing in the ears?
Sure. Ringing of the ears is the medical term's tinnitus, and it's something that we see a lot. It's something where 40 to 60 million people in America alone have experienced tinnitus at some point. The most common reason that we will see patients with tinnitus is secondary to a nerve damage, which is associated with a nerve hearing loss. I see this in often patients who have become older and wiser, and the inner ear and the organ of hearing has sustained damage over time enough where they have ringing of the ears and hearing loss. Other patients that we see, people that have been around a significant noise exposure, whether that be in the military, they may be hunters and shoot guns, things like that, they will also experience a ringing of the ears and hearing loss. There's also other times you can get it. When we talk about tinnitus, I typically differentiate it in what we will say is pulsatile, where the ringing of the ears is almost like a heartbeat, versus someone that has more of a non-pulsatile or a chronic ringing of the ear. Patients that have the pulsatile variation, they may have more of a vascular problem as opposed to an inner ear problem. They could have blood pressure issues, they could have a benign tumor that's a vascular tumor of their head and neck, things of that nature. But it's important to differentiate that and let your primary care physician know that you may need an ENT referral based on that.
So again, it's important, and we've talked on previous episodes too, that you really partner with your healthcare professional, tell them, and helping describe how it is. So I heard you say, you know, whether it's pulsing or whether it's ongoing, those types of cues you actually look for when you're talking to your patients, correct?
Sure, it's important to really get detailed information about whatever the problem is, because just on history alone, you're able to really classify what you're worried about and what you think the problem is, and ultimately will help decide what treatment is needed.
I heard you mention individuals that might, job-related, military, maybe hunters. Do you have any suggestions for our viewers as far as ear protection?
Yeah, anytime that you are around significant noise exposure, most patients need to have some sort of ear protection. You have earplugs that are pretty good, they work pretty well, but the mainstay, the best type of therapy is actually to use ear muffs that fit over your ears. I see patients that I will ask them about noise exposure over their lifetime, whether or not they've worked in a factory or something, and they will say no. And one of the things I always follow that up with is, well, do you mow your yard? And they'll say sure. And they've ridden a lawnmower for an hour or two every week for 4 to 6 months of the year, and that over 30 plus years is enough to cause damage, especially if you're not wearing protection. So just things like that I would recommend patients use. Of
course, with society becoming high-tech, we're seeing a lot of individuals use, I guess, their earbuds or headphones, Bluetooth with cell phone. What recommendations do you have for those individuals?
Again, it's all about how the intensity of sound. If the louder the music or the louder it is, the more damage you're going to do to the middle and inner ear, which is ultimately going to lead to hearing loss and potentially tinnitus as you get older. They make, with specifically for the earpiece for headphones, we actually have started making personalized ones that actually reduce the damage over the course of wearing them. So there are some things that we can do medically that some audiologists are able to fit patients with more appropriate earpieces.
Excellent. And of course, all of the repetitive things that we do, whether it be riding on the lawnmower, listening with our headphones, and going to concerts or whatever we're doing, all that repetitive can add to damage later on, correct?
Sure. It's very similar to sun damage, where we think a lot of that damage has been done in the first half of your life, and then it's just been a concurrent episodes will continue to cause damage.
As we wrap up, tell us a little bit about just some tips for maybe those individuals that are having some sinus problems. Of course, we talked about living in the Ohio Valley, and over-the-counter nasal sprays and different things like that too.
Yeah, there's a lot of controversy about using over-the-counter nasal sprays. There's really two types of over-the-counter nasal sprays. There is the saline nasal spray, which is basically a saltwater solution that is very helpful for patients. I find this time of year when there's a lot of allergens, it's dry and irritating to the nose, just to use the saline nasal spray in the morning and evenings is very helpful. There's the medicated over-the-counter nasal sprays, which are basically the decongestant nasal sprays, and these are the ones that historically patients can get addicted to, which is not good for your nasal and sinus cavities. Those, such as Afrin, I usually recommend patients if you have an acute infection and you're needing something to help breathe through, help the congestion in your nose. I would say that I tell patients to use that 3 days on, 2 days off, and kind of use that for, as you need over a couple weeks. But more than that, I would not use those medicated nasal sprays.
And then toss it after the infection, correct? Just like a toothbrush.
Absolutely.
Toss it afterwards. We were talking about nasal spray. Is the verdict still out on, I believe they're called neti pots?
Yeah, neti pots are a little bit more aggressive way to debride or clean your nasal and sinus cavities. Again, you're using a saline nasal spray solution, except you're using it more aggressively to really flush out the nasal and sinus cavities. There's also some other nasal and sinus rinse kits that are also very good. Some patients can use those when you have an acute infection to help flush out the infection in the nasal and sinus cavities. Some patients don't like them, don't tolerate them, so this is something that
very personal.
It's something you just kind of try and see if it helps.
Great. Dr. Wilson, we so appreciate you being here with us this episode and sharing very important information regarding our ear, nose, and throat. Viewers, if you'd like more information, please check out our website at www.hmh.net, and we hope you tune in next month for another important edition of Health in the Heartland.